po yun eh. Kasi yung...
The one that is portrayed now in front of us.
Ito po, dahil self-administered po ito, individually packaged po ito. Pinapakita po dito na yun nga po, hindi po ito yung kagaya ng na-aprobahan namin na pag binuksan mo yung isang box, napakaraming naman. Saka wala pong yung aming napa-aprobahan ng araw, wala pong nakalagay po for test kit, for self-administered kit, wala pong gano'n nakalagay sa label. Ito po yung ating gusto sanang imbitahan ng mga manufacturer at drug importer, product distributor importer na kumuha po sila ng special certification para mabigyan po ng special certification at maging available po sa ating mga outlets. Ito po ay meron special picture po yung mga minsan itong mga self-administered and home test kit, for example po yung built-in po yung pag-handle po ng mga biologically effective waste. Meron din po minsan itong mga built-in po yung positive and negative control. Kaya po ibang-iba po ito sa naaprubahan na po ng FDA. Pero minsan magkahawig po yung karton o yung packaging. Yun lang po ang gusto kong iparating po sa...
Packaging na yan. Sa packaging na... So, wala naman siguro. I'd like just to read. Now, I warn the public that yung statistics namin magkaiba. Kasi yung ibang dapat magbigay sa kanilang report, sometimes it's not on time or it is a product of yesterday collated from amongst the providers. So, hindi yung the statistics ni Secretary Duque need not necessarily dovetail my report because itong report ko ano yung araw na to. So there is no denying that the COVID-19 situation in the country is becoming more alarming every day. Madaling sabi, may problema tayo. Nandito na yung COVID-19 pati yung variants, what makes it difficult to maybe treat on time. Halos pareho lang siguro. I hope that's the same banana that is applicable to all yung mga gamot natin. Ang sitwasyon natin, new cases of COVID-19 continue to rise daily from more than 21,000 on January to more than 33,000 today.
Sila niya naman si Stamin.
Bukod sa kanyang anak ay alalahanin
to more than 157,000. On January 7, experts noted a high COVID-19 reproduction rate in NCR in more than 5, meaning there is one COVID positive person that can be able or can infect more than 5 persons. Taas naman ito. Our positivity rate as of January 10 was about 46%, meaning that at least 4 out of 10 persons tested for COVID-19 will turn out to be positive. So, what we did was after placing Metro Manila, Bulacan, Cavite, Rizal, and Laguna under alert level 3 to reduce the mobility and exposure of the coronavirus, more localities will be placed under this stricter quarantine period pagkat nagkagrabe ang sitwasyon. The following areas are under level 3 from January 9 to 15, 2022. And it's Batangas, Bataan, Cagayan, Pampanga, Zambales. Those are the provinces. Now the cities is Angeles City, Baguio City, Dagupan City, Iloilo City, Lapu-Lapu City, Lucena City, Naga City, Olongapo, and Santiago cities. Businesses are required to operate at 30% indoor capacity and 50% outdoor capacity in areas under level 3. Buses, jeepneys, and other forms of public transportation operate at 70% capacity. O limitado kaya. The same as I have earlier directed, barangay officials will enforce strict adherence to the quarantine protocols, including restraining unvaccinated persons from leaving their houses, and they will do this legally. As I have said, we have every right to restrain the move. We cannot wait for ILO because ang Congress kasi ano ba kayo bang recess kayo, and passing a law is really very tedious in a democracy. In the meantime, kung hindi pa ang Congress wala pang batas, hindi sabihin na hindi tayo maka-intervene because I said there is a calamity here, a national worry. We are now working to increase bed capacity of public and private hospitals in NCR and surrounding areas. The DOH, or the National Task Force for COVID-19, have been instructed to immediately communicate with NCR hospitals to determine how of the COVID-19 bed capacity is allocated. Over one hospital command center is also to work on real-time updating of our health system capacity based on functional bed capacity, as well as take into consideration the number of available health workers. Maraming pumapasok dyan na iba-ibang report, pero i-simplify na lang natin. The IATF, the task force, and the DILG are working to ensure that emergency operation centers are placed in all government units. We also need to increase the RT-CPR testing capacity in NCR plus areas so as to handle the influx of tests and to ensure that laboratories are operational 7 days a week. Ang universal complaint talaga is kulang ang facilities ng itong RT-PCR. We need to buy more, you think, sir?
Yes, our expansion is ongoing because we would want that every province will have an RT-PCR, but also the private sector is building more RT-PCR laboratories. So in all, we have 312 laboratories from 1 to 312.
So, ano ba, is that a machine? I have not seen that.
It's a machine, and also it has a test kit that is used to detect the virus from the nose and from the throat.
Kailangan pa magbili pa tayo?
Meron naman tayong pera for the 2022 budget. We have asked, I think they're kung di ako nagkamali, mga 7 billion ang outlay for that. So we will just continue to buy some more.
Sige, bili ka para makatulong tayo sa marami. Finally, the National Vaccination Operation Center is directed to increase vaccination rates outside NCR as soon as possible. Ito nga, balik tayo. We sound like a broken record, but alam mo, ulitin, I really do not know how to do this, but I've been pleading almost on bended knees for our citizens to get the vaccine. Kung magsabi na maraming vaccination centers, mamili ka lang. And you need not be a resident of where that vaccination center is. Sabihin mo lang, Pilipino ka. Wag na yung lista-lista, tapos kung wala ka sa listahan, kalukuhan yan. If you are a Filipino, that's the only requirement. You are a Filipino, go to any vaccine center, yung pinakamalapit. O sa trabaho mo, you pass by, sabihin mo lang, hindi pa ako na kapag kuha ng vaccine. And that's the only requirement. You need not be a resident where the place where the RT-CPR is located. Mamili ka lang. Basta Pilipino ka. Hindi na kailangan yung residence. The important thing there is whether you are a resident or not of that place, that you get the vaccine. As of January 9, our total doses administered throughout the country is more than 113 million. Ngayon na nabakunahan na, we have administered more than 57.6 million first doses, more than 52.3 million second doses. So hindi magkalayo. And I'm happy to note na bumabalik kayo for the second dose. Yung isa, hindi obra yun. And more than 3.3 million booster doses. Again, I suggest yung napakunahan na ng dalawa, kung gusto mo ng more defensive whatever, kunin mo uli yung booster mo, punta ka lang doon, sabihin mo lang na pang-tatlo ito. Total, kung may tatlo na kayo, tapos magkuha ka pa ng 4, ikaw. Alam mo ba ang bakuna? Yung bakuna, yung binibigay sa atin, yung virus yan, pero patay. Para pagpasok sa katawan natin, makilala ng ating antibodies at dumugin niya ng antibodies natin, yung immune system natin. At yun ang mapapigil sa sakit, if possible. Pero yung ibang bakuna, yung binugbog lang nila pero buhay. Some vaccines are like that. Ituturok yan sa iyo, mga weekend, talagang para bang kung ang tao pinutulan ng kamay pati pa. Yun ang injection sa iyo para maglaban, para makilala. Ang importante kasi makilala ng ating antibodies yung kasi inaaway niya yan kakainin talaga ng antibodies yung anong ipapasok mo dyan. Pero minsan ma-overwhelm, matalo yung antibodies natin, yun ang maging weak kasi sa dami ng mag-multiply yung magkasakit. Yung sakit is a reaction. Ang fever is not bad at all. It is an indication kung lang may lagnat ka, hindi masama yan. Yan ang sinasabi ng katawan mo na there is something wrong. Nag-warning yan siya. That's why lalagnatin ka. Warning yan sa ating katawan na something is wrong with the system. Yan nga. Kaya hindi ka mamamatay because Paglagnat mo, punta ka sa doktor, di sabihin niya, baka COVID yan, magpabaksin ka na lang. Eh kung may bakunado ka na, hindi na mahirap magpasok na, kasi alam na ng antibodies mo at kakainin yan, tatalunin yan. Was final anesthetory until now. Wala sa ngayon naghingi siya ng correct talaga. Yan lang ang alam ko kasi to date, a total of more than 213 million COVID vaccine doses have been delivered to the country. I strongly urge our kababayans again, it will save you sa kamatayan. Kung mabuti, kasi kung Omicron lang, kasi sabi weak, eh kung dumako sa iyo yung COVID-19 talaga, pati yung Delta, paano yan ngayon? Do not try to minimize or second guess what foreign body entered into your system. Kaya ang problema dyan. Pagsabi lang Omicron, yung pala COVID-19. Field offices of the SWD are working closely with our LGUs for the ongoing relief efforts alongside the work of our national government agencies such as the NDRRMC, DND, DPWH, DIC is DO is the Department of Energy, Philippine Navy, Philippine Coast Guard, among others. Well, of course, the entire armed forces were there every day also in all places. As we have earlier committed, the government will provide cash assistance to the low-income families that were severely affected by Typhoon Odette. Meanwhile, before 2021 ended, a total of 46 national road sections have already been cleared and reopened according to the DPWH. I'm referring to the areas that were hit by the typhoon.